And I firmly believe that I think abortion should be rare, but I believe it's the right of a woman in consultation with her family and her loved ones and her faith to determine what it is she wants to do in regard to her reproductive health care rights. The idea that 26 states have or are passing legislation to further deny women a right to reproductive health care is extremely troubling. And I thought it would be good to meet today and just hear from women leaders in the community about what you're thinking, what you think I could do to help. And you know that Democrats in the House have passed legislation to protect a woman's right to choice. And I have legislation that would protect a woman's right to contraception. And we'll continue to work on those and try and get those passed. It's a heavy lift, there's no question about that. But at the local level, you guys are seeing the fallout from this. And I'd like to hear from you what you're experiencing and what you think I could do or we could do together to help. So having said that, I think we'll just go around the room and we'll start with Jackie. You can introduce yourself. With the time, I think everybody has.
I'm sitting here and I'm thinking of something that my father said when I was growing up, and he said that this was the best time for us to be a woman. That with Roe versus Wade, at that particular time with the Equal Rights Amendment, all these things were coming forward so that women could actually be someone and be something without benefit of being married. And
This is Nancy Pelosi. I'm not taking a call from.
Don't worry. Oh, take a call from Nancy. Tell her I said hi. And so at that particular time, we were fighting to make gains. And now I feel like we're fighting to maintain the status quo a little bit, and maybe we took it for granted. But one of the things that I wanted to say in particular about healthcare is that we are being told more and more often that we need to be looking at social determinants of health and how it impacts the healthcare of the people that we serve. And in the course of doing that, it seems to me that some of the decisions that we're making is actually going to increase those determinants of health for a lot of people. People who have money, who have means, they will find a way to get their contraceptions, their abortions, all that wonderful stuff. But people who do not have those opportunities will be the ones to have to take advantage of social programs, of other type of governmental support. And in the states that you're looking at right now that either have trigger laws or looking at having abortion laws, they're very, very weak on their social programs. It's almost as if they're saying, we will support you while you're pregnant, but oh, when the baby is born, bye. And so what's going to be the cost? What are we kind of, I'm going to use a bad term, sentencing this child to be? If someone has made a determination that they want to change course because they're looking at their situation and they're looking at what it is that they can handle, then we should allow them to have that opportunity. It may not be my choice, it may not be your choice, but it may be their choice. And who am I to inflict my choice on someone else? And that's kind of what we're doing here in this country. And again, if we were doing that and we were willing to be there to help and support that child when they were growing up, that would be one thing. The same laws that we're using to keep guns in people's hands about, this is my right, don't count when it comes to a woman. And I was telling my husband, because my husband's a big political animal, and he was listening to this gentleman out of Indiana when Indiana passed their abortion law. And the gentleman basically said, it's not your right, it's not your womb. And I was like, I need to make this into a T-shirt. And it needs to go across to every women's group in America that basically states that this gentleman is saying that women no longer have the right and that we are basically an incubator of some type. So what we're seeing right now is we're seeing a large increase in people who are trying to get not regular contraceptive, but long-acting contraceptives. So, you know, IUDs and things like that, because they're very, very fearful that this will spread across into other states. And, you know, we're doing a lot of them right now, and we can barely keep them in place. But some of the things that we're seeing that I'm a little bit concerned about is you know, it's kind of causing this chilling effect of, you know, what is next. And I think that, you know, this toppling of Roe versus Wade was a real cornerstone for other rights to be taken away. And so what we're seeing right now is people who are coming in who are anxious because of the fact that they don't know what is the next kind of right that will be toppled. And so I think we really need to kind of address not only trying to regain some of the rights that we had taken for granted, but to ensure that the rights that we have will remain.